Magandang hapon sa inyong lahat. So today, I would like to introduce all of you to Doc and Attorney, or what we usually call him, Doctorney, Joey Montemayor Jr. So he's actually a doctor of medicine for cardiologist. He's also an economist and medical technologist, as well as a lawyer, consultant, and an educator, as well as a civic leader. So this is right up his alley. And I know ngayon there's this thing called new normal. So as we go along, he's going to help shed more light on this so-called new normal. So throughout the webinar, if you have any questions, feel free lang po to have them all on the chat box. That way, during the open forum, pwede natin ma-address. So right now, I will give the floor, or should I say the screen, over to Doc Joey. So, Doc, good afternoon. Yes, so Doc, in the previous webinar, we discussed the different regulations that will um, be followed during this so-called new normal. And as we approach the upcoming general community quarantine, or GCQ, here in Metro Manila, so a lot of the HR practitioners here, or business owners, have a lot of questions. So just to have a quick recap, Doc, can you run us through the different new regulations, such as what will work be like moving forward?
Yes, there are interim. I can start. No? I can start.
Yes po, Doc.
Yes, there are interim rules formulated by DOLE, DTI, in cooperation with the Department of Health regarding workers' workplace rules and regulations. Now, uh, these are interim, so meaning they are just temporary, but eventually they may evolve into more stricter rules, or they may relax some. So in view of this, uh, I have stated in our previous lecture that there are strict guidelines as far as the employees, not, and also the employers concerned. So in this case, we have to start with the medical conditions. You know for a fact that there are three classes. That there are three classes of patients in COVID. Those who are asymptomatic, meaning they do not manifest signs and symptoms. These are carriers, and also the pre-symptomatic, those who are only manifesting vague vague symptoms, and also those who are the third category, symptomatic, who needs sometimes to be confined, and sometimes they need intensive care, intensive care confinement. So there are many rules in the workplace in the COVID era. So these should be followed strictly, and these are not just precautionary measures, but total precautionary measures, not only when a particular situation calls for ECQ, but also GCQ. I heard from vine sources uh, that come June, we will have GCQ. Please take note that it does not distinguish or differentiate whether ECQ or GCQ in the workplace. These are the same. I just want to underscore the fact that the second is that there are no changes as far as rules, as far as benefits of the employees, uh, even in the COVID era. So the all rules are in place as far as the protection of employees is concerned. So before entry, employers and workers must have face masks. So please take note that face mask is very crucial, very important. Uh, I uh, I emphasized in my other lecture that Spanish flu killed almost 200 million people. And it was only when face mask was introduced to the people that this Spanish flu in 1918 was stopped. So everybody, including employers, should wear face masks at all times. And this face mask must be provided. Do not bring your own. Please do not bring your own because the history of that face mask is unknown. So the employer must provide every employee a face mask. No, it is only removed. That face mask must be removed only when eating or drinking. Okay, so uh, this is required. The work arrangement is required to be developed by employer. And please take note, uh, the rules are still subsisting. So there must be no diminution of benefits. Okay, so those who are suspected of having COVID or probably PUI or PUM must be brought to the nearest hospital if they are already manifesting symptoms. Okay, and companies must put up a hotline and call center for employees to report if they are symptomatic. Okay, employers may test workers, meaning it is not mandatory. It is not mandatory because the testing is actually very expensive. Testing kits must be procured by the employers, no? So and these testing kits will not be charged to the benefits and also to the salaries of the employees. Okay, so high risk groups, workers that are vulnerable, the senior citizen, those who, even if you are not in that age group, if you have comorbid conditions like diabetes, hypertension, you have probably cancer, or you are immunocompromised, please take note that high risk pregnancy is also included. Okay, so uh, meetings must be reduced, or if can be avoided, no, the meetings must only be as much as possible virtual, like in this case by the use of Messenger or probably Zoom or Google Meets. No? So what about visitors? Visitors must accomplish must they must accomplish the visitor's health checklist form provided by DOLE. So you cannot just make your own. It is a form provided by the Department of Labor and Employment. Yeah, this is usually accessed through the website. Uh, okay, private establishments, this is very important, must implement, especially now whether you are in the ECQ or GCQ, alternative work arrangements such as working hour shifts, work from home where feasible, and also rotation basis. So also private establishments must provide shuttle services, decent accommodation, and near site location to lessen travel, to lessen people movement. Okay, so these are very important as far as the workplace rules are concerned. So everything, even eating, it is no longer encouraged for you to work or to eat in the same table, but one table per employee. So probably you can have an alternative schedule. So okay, please take note the temperature that was set by Dole is 37.5. Medically speaking, you have fever. Please take note, you have fever as far as we are concerned, the doctors. we set it at 37.8. But Dole, uh, once it was noted that your temperature is at 7.5, then you have to have a 5 minute rest. Then retake it again after that. Then if it is still at 7.5, then they will do isolation as far as you are concerned. Okay, so please take note that you should also have a monthly reporting of illnesses, not only COVID, no, but also in illnesses and diseases and also injuries. Utilizing the DOLE WAIR or the Work Accident Illness Report form. Okay, so with that, no, I think we already covered everything. So if you have any questions now, I would like to emphasize. I would like to emphasize that there are two things that should be followed here. Number one, the labor cost. They are still intact. There can be no change. Only Congress can change those laws, and implementation of this must be strictly followed as far as the letter of the law is concerned. Number two, there must be proper consideration of the science, the COVID. Is there because this is a very highly contagious virus. The important thing here is that you must be updated in the natural history of the virus, because this is affecting everything: our travel, our workplace, the way we eat, the way we converse with one another, the way we communicate. That's why it is very important to underscore the importance of the science. So you do not just consider the laws that are in place, but also the nature and the natural history of the virus. We can also entertain questions as far as the virus is concerned, because there are changing patterns now of symptoms. As far as symptoms, because before it is only a respiratory problem, but now it can also damage the heart, the liver, and also the brain. So with that, I think those are sufficient. No? So if there are questions as far as the employees are concerned, because I think there are a lot of still questions hanging around. How do we deal with those as far as the employer is concerned, as far as the employees also are concerned? So thank you very much. No? That is just a wind up of what we discussed last week.
All right, thank you so much, Doc. So we will now proceed to the question and answer portion. So before the webinar, we actually gathered some questions from our viewers. So let's tackle the first one. Next slide, please. All right, so a lot of them are actually asking what the extent of liability of an employee is when they are found to be COVID positive while working.
Okay, there are two important things. There are two important things here. Number one, uh, when was although he was found to be positive while working, but when was the first time he manifested symptoms? Because there are employees that even before the resumption of work, they are already manifesting symptoms. So it must be identified. It is not automatic, but that when you are positive while working, the employer is already liable. No? Although if it is found that it is work related, because you are being asked to go outside and perform your work, then all the hospitalization, all the medicines, all the professional fees of doctors should be shouldered by the employer. But if it was found out that you are already manifesting signs and symptoms even before the resumption of the employment, then uh, the employer can only shoulder 50% of the hospitalization because uh, the employment only aggravated an existing condition. So it is very important to point out if when was the last time the patient manifested symptoms, because many employees after the lockdown, they some employees are going from place to place. So in that case, the employer has no control, even before the resumption of the work, has no control where the employer went. So in that case, it must be properly identified. But if it is work related, even because of the work he was exposed, then all all hospitalization, all the doctor fees, all the laboratory examination should be shouldered by the employer.
All right, thank you so much for that, Doc. So another thing kasi, while we now transition supposedly to the GCQ, a lot of employees and employer alike are actually scared of going back to the office for fear na baka makontract nila yung virus. So is it okay to refuse work during the GCQ by next week? Or is this a term in is this like an offense where the employee can be terminated should they refuse to work?
Okay, this is a very important question, no? Because the basis for suspending or terminating or for the employee to continue work is the reasonableness. For example, in their place there are a lot of COVID positive. The fear is very reasonable, but in case there are already no reported new cases or active virus spread, then that is unreasonable. So we look here it is a case to case basis. If the employee, please take note that many employees are still they still receive their salaries even after the lockdown. So in this case, look at the reasonableness of the situation. Uh, is the because if the fear is very reasonable and true, then the employee, we have a lot of cases actually, because many employees did not report to work even after the lifting of the ECQ in other provinces. So in that case, if it is unreasonable, the termination of employees is also in place, because you cannot just make a waste basket reason in order for you not to go to work. So look at it's a case to case basis. Please take note whether it is ECQ, whether it is GCQ, whether it is NECQ. It does not actually prevent the employee from working. So also the employer cannot just stop the employer or the employee to stop working. So the reasonableness of the situation uh, should be the proper basis for whether terminating the employee for not coming to the work, for going to the work.
All right, thank you. So, another thing, pero opposite naman to siya, do. Kasi, of course, kapag di ka nakapag-work during ECQ or GCQ, may iba na no work, no pay. So, for example, if ganyan yung setup, tapos it turns out that the employee is either COVID positive or is required to undergo quarantine, is it possible for the employer to allow him or her to work from home? Given, of course, di naman siya pinipilit, kusang loob talaga ng employee na mag work during his treatment or kaya during the quarantine period.
that is already a violation. But that is a violation of the interviews because if he is if he is COVID positive, whatever the method, whether rapid testing or PCR, uh, or whether he manifests signs and symptoms, he should not be allowed to work. Number one, even if he or she has no symptoms, he or she may infect others. Because please take note that the most grave or the most serious situation is that when you have a lot of COVID positive who manifest no symptoms. So in this case, all COVID positive should not be allowed to work. That is actually that's already a basis for not reporting to work because a COVID positive meaning you may be an asymptomatic carrier. It is not he who is being protected, but also the other employees who are working who are COVID negative. So in that case, there are a lot of spread, especially in the United States, who are allowed to work when they were COVID positive, even if they do not manifest any signs and symptoms. So when a person is already tested COVID positive, he should not be allowed to work because of his contagiousness. That is actually one of the reasons, very important reason why they should not be allowed to work. Although they may continue receiving the benefits and also salary. So that is a very important question.
All right. Kahit work from home setup siya, Doc, or like kahit remote working. So for example, may internet naman sa hospital or kaya sa bahay nila, di pa rin pwede.
Well, pwede po 'yan. Ang sinasabi natin ano, ang sinasabi natin yung pupunta sa pero yung mga flexible working arrangement wala namang sintomas. Yung mga secretarial work, yung mga HR work pwede naman sa bahay 'yan. They may continue working even if they are COVID positive. Unless they manifest signs and symptoms, they should not be allowed to work. Because even working from home entails stress also because you are using the mental state of a particular person is also being affected in work from home situations. So if they do not manifest any symptoms, they are not sick, but they are COVID positive, then they may continue working in their homes. But of course, there are a lot of employees who who cannot work from home. They should be physically present. For example, in manufacturing. So in that case, they are exempted.
Okay, thank you so much, Doc. So for our next question, Bads, next slide, please. So, for employees naman who, for example, the company has given flexible work arrangement, so no need na to go sa office. Pero for employees who are unable to work from home, for example, wala silang internet, wala silang devices, tapos di ma-provide ng company, are companies allowed to actually terminate or let them go?
Well, this is possible, but should not be arbitrary. There are also, for example, if the company is losing a lot of money, they incur serious business losses, then they can also cite just causes or the authorized causes. The authorized causes such as serious business losses, uh, redundancy also, automation, retrenchment, those that are in the law. Now, they may not terminate employees just like that. The two notice rule, the two notice rule must it should be respected. For example, the notice that they are being terminated because of such reason, and the notice to terminate them, that is still in place. Uh, well, it is possible because of serious business losses. But individually, pinpointing one person, for example, there are a lot of employees who were unable to work from home during ECQ, and only one or two employees were pinpointed to be terminated. That is an invalid classification, and that is not allowed by law. But if you are terminating all employees because of serious business losses and they can no longer work from home, well, that is very reasonable, especially if they cannot, if they can no longer sustain the running of the company.
All right. So following up on the losses bit doc. So for example kasi may mga employers talaga na nagre-retrench dahil nga business losses tapos di na nila kaya babayaran yung lahat ng employees nila. So are they compelled or are employers compelled to provide separation pay for those under probation, or will the standard employee notice as well as the DOLE notice be enough?
Well, dapat po, if it goes under probation, whose probationary employment is not yet finished, then employers must also give separation pay. If the probationary period is not yet finished, for example, it is already finished during the lockdown, then those kind of termination are not allowed by law. The probationary employees must be given a reasonable period to prove their possible regularity of employment. So ang ano po diyan ay if because these are authorized causes, except if there are serious business losses, the company cannot and may not give separation pay. That is covered by a lot of jurisprudence. So yan po, no, tinitingnan din natin if the company is still can still run even with few employees, or if it will resort to this the if he has a asset, if it has assets to sell, then separation pay even for the minimum of one half a month of service, then that is allowed by the law. But if it is really serious business losses, then separation pay may not be given.
All right. Thank you so much for that, Doc. Tapos, eto naman, may mga companies kasi na since right now they're starting to resume operations, they will need new hires, especially for example, the BPO sector. So, may mga new requirements ba na kailangan from these new hires? Kasi right, DOLE requires yung health clearance, yung travel pass. So, will this be a new addition to the already set, yeah, to the already set requirements for those who got hired?
Okay, ito po yung mga bago, no? New hires before the start of employment must present a COVID testing, COVID testing, whether it is rapid or whether it is PCR. Number two, full physical and mental examination. So these are additional requirements. Plus, of course, the previous even before the COVID, there are a lot of requirements also. But the additional requirements are COVID testing, physical examination, no? Complete physical examination, not just by any private, but a public doctor or physician. So in that case, also it is important to consider mental examination also, because we see a lot of rise or increase in mental cases during this lockdown period.
All right, thank you for that insight, Doc. So next naman, we have a very interesting and also very part specific question. So Bads, if you could go to the next slide, please. So eto, one of their employees tested positive for COVID. So basically, the company shouldered all medical expenses and even then still continued to pay his salary while hospitalized. And after months, nag-recover na siya and still, nakuha niya pa rin yung pay niya. So ngayon, para to make sure na full recovery at saka ma-prevent yung recurrency ng virus, he was placed on a 3-month leave. Now, nagtatanong po yung employee na kung ano yung magawa or mabigay ng company to help him while he is on a 3-month leave kasi nga no work, no pay status ngayon. So, um, did the company compensate him enough during the time that he was tested positive? Or is it right for the company to tag him as no work, no pay during recovery?
That's correct. Correct. He is already classified as no work, no pay. And during the time, he is not working because the company already spent a lot of expenses during confinement. And not only that, while even after he recovered, he still got his pay. So at this point, you can classify him as a no work, no pay employee. I think he also already he is very fortunate that his medical expenses was shouldered by the company. I know of a lot of companies who did not shoulder the medical expenses. Here you can already tag him no work no pay while recovering for 3 months.
Okay, sige. Thank you so much for that, Doc. Now, we will now move to the questions that are posted here sa group chat natin. So, eto po, from Miss Hyacinth Peña, Florida. So, nagtatanong siya na, is it mandatory to require employees who previously exhibited mild symptoms to submit medical certificate or fit to work even though they went through the 14-day quarantine? Now, some of their employees are hesitant to go to hospitals or clinics because baka ma-expose sila sa virus. So what will the employee do or what will the employer do should the employee refuse to comply or provide medical certificate or fit?
Well, it is reasonable for the employer to require COVID testing because you see if again he or she manifests symptoms during employment, then the company will again shoulder that, especially those who have history already of symptoms. So in this case, the company may require another examination, physical examination, if the employee has symptoms. Karapatan po ng employer yan. Not only for the protection of the employee's health, but also the vulnerability of other employees from being infected. So here, makikita po natin not only the protection of the employee, but also of the co-employee. So that's why it is very important to require also another certificate for the resumption of work. uh, it is a very superficial reason to say that you have a fear that you may be infected in going there. Even if you will not go to the hospital, there are testing centers who are actually just clinics, and we have already 66, or I think almost 80 testing centers who are not in the hospital. They do not have confinement. So in that case, it is not a valid reason to avoid testing in order for you to resume employment. It is also very important on the part of the employer to protect other employees who are continuously working of being, for example, of being infected. So that is a very reasonable. Uh, if you remember right, I I I told you that there are two bases for employment now. Before, it is the only basis are our labor laws. Now it is not only the labor law but the science behind the COVID. So that is a very proper consideration because the employer also has to protect not only employment but also the employees who are already working at the time of the resumption of work by an employee.
All right. So, eto naman po, Doc. So, during the ECQ, some businesses were cease their operation. So, meaning, yun, yung mga employees nila, no work, no pay. So, now that businesses are starting to resume, can employers actually process RTWO for those employees who are no longer responsive via text, calls, or emails?
Well, that's right. For example, there is already resumption of work, and the employees are being offered again or to resume work. But if they refuse to work, that is a legal that is a legal basis for terminating employment, because the company, where when there is already relaxation of the lockdown, has to also operate in view of a lot of losses. Not now, if there's refusal of work and it is not an unreasonable, it is not a reasonable one, then the company may terminate that employment who refuses to work.
All right. So, what if going back po yun sa testing kits or yung testing of the employees shouldered by the employer, is there actually a specific law or advisory that supports it? Kasi as for most HR, yung mga management, they usually request supporting documents para ma-approve yung request ng HR kasi nga it also involves costs for the company. So is there a certain advisory that requires employers rather to test their employees and shoulder these tests?
Well, the interim rules says that the employer will shoulder all the testing, whether it is rapid or PCR. Now, because it is very expensive, especially the PCR, which is, I think, the cheapest is 4,700. Now, if the company, it is it is not actually, the government will not interfere if the employer will rather choose not to test. Because please take note that the interim rule only says may, meaning it is not mandatory. It is also the option of the employer. But the problem here, if they want to test and the employee refuses, but as far as the employer, he may or he may not require testing. So the only problem is that if they require testing and the employee refuses to be tested, but it is an option. Actually, the interim rule says that the employer may test, meaning uh, the employer is not forced to test every employee.
All right. So meaning to say, Doc, case to case basis pa rin. So in terms of the employer's liability or yung ano nila, yung need to test will ultimately depend on whether or not the employees are showing or exhibiting symptoms. Pero before they can resume work, of course, the employees still have to present a med certificate. Is that right?
Correct. Because some employees are requiring, for example, in one of our companies that I represent, they require, even the CEO was required to submit a COVID testing, whether it is rapid or PCR. It is the option of the employer. But there are also big companies who require every employee who is resuming or who wants to be employed immediately. They require that employee to be tested because they have already testing centers in some of the companies, probably rapid testing. But of course, there are small companies where they cannot just shoulder everybody's testing. So, yan po, nasa kumpanya pa rin yan. Many companies also are very much relaxed. No? For example, convenience stores. those other grocery stores, they do not require their companies or their employee to be tested, whether it is fast testing, rapid testing, or PCR.
All right, thank you so much for that info, Doc. Now, going back to new hires, kasi diba you mentioned necessary na mag-include as part of the requirements yung COVID test as the medical testing before hiring. So, if necessary talaga siya, Doc, will it be charged to the applicant or will the employee or the hiree have to pay for it, or will the employer shoulder either a certain amount or the full amount of the testing?
Well, if he or she is already accepted, then if he or she is already accepted, then the employer may give 50% of the testing fee. Uh, but in case because they only use some they only use because of the volume of patients, they only use rapid testing, which is cheaper, which is cheaper, uh, especially those that are made in China. So in this case, uh, the employ the employer may shoulder only 50%. For example, 1,200, they will shoulder the 600 pesos payment for the new hire. But there are also employees, I think they can waive the testing because there are a lot of employees, they are actually positive. No? They are actually positive, but they do not manifest. Please take note that we do not have only two classification, asymptomatic or symptomatic. We still have another one, asymptomatic, pre-symptomatic, and also symptomatic. So in that case, the symptomatic and the pre-symptomatic here, these are the spreaders of the viruses because they are actually carriers of the virus.
All right, thank you, Doc. So, in terms naman po, for example, kasi 'di ba ngayon a lot of LGUs have the authority to actually put yung mga tao nila under a 14-day quarantine, especially if they're exhibiting symptoms. Now, for those people who are required by their LGUs to go on a quarantine, are the employers obliged to pay for their wages regardless?
No, because well, that is a government regulation, and actually that will interfere in the employment. In that case, if it is only a 2 week period, the company may not pay their the, the duration of that quarantine because the company will lose a lot if everybody is being placed in quarantine. So the company, that is already outside the realm of employment because that is already a government rule or regulation for those who are being suspected or monitored as a possible COVID patient. So in that case, the employment may be temporarily suspended while on quarantine, and the company is not forced to pay their everyday or wages because of that, because they will entail a lot of losses.
All right. Tapos naman, Doc, in terms of hazard pay, for especially for those in the front lines talaga. So right now kasi hazard pay is actually just covered or mandated for government employees. So not much for the private sector. So now that COVID happened, and as mentioned, a lot of changes are being made in terms of these laws, or yeah, meron bang interim law, or is there any plans for the government to actually make sure that these frontliners in the private sector are also covered by this hazard pay?
Well, if that employee, if they acquire the COVID virus, during the time that he is employed, then he should be given that hazard pay. Because but if not, then the private company may not be forced to give a hazard pay. Because, for example, there are a lot of service companies who deliver mail, who deliver products, who deliver foods. Then these are employees who are very much exposed to the COVID. Remember that COVID transmission is still being debated whether it is airborne, and there are a lot of supporting papers by the CDC and other research companies that the possibility of being airborne is still there. Even the WHO mentioned that the possibility is still there. So only those who are actually in a hazardous situation be given a hazard pay. So uh, if only once you are exposed, then it is very hard to identify really if you really got that virus because of your employment. So, because the question mentioned frontliners, then they should be given a hazard pay.
Okay, thank you so much for that, Doc. And next, we actually have another question from Ms. Charzel Acuna. So, some of the employees are asserting that they can't allow them to work because of the DOLE Labor Advisory 1 series of 2020. Now, will that be applicable during the GCQ given that public transportation is now made available?
Well, those interim rules, please take note that those interim rules do not distinguish whether it is ECQ, MECQ, or GCQ. And also, although we have already traveled only by private cars, buses will resume only on June 21. Whether it is whatever method it is or scheme, GCQ, ECQ, these are still in place, all the rules. And the interim rules did not actually distinguish whether it is ECQ or GCQ. They are still in place. Whether it is already we are already in the GCQ come June.
Okay, makes sense, makes sense. Now, for this one, we have another question from Luz Lunasco. So, will the employer be required to provide the equipment and internet access if the employee wants to work from home? So, if the company can provide for such, can the employee be put on a no work, no pay basis?
Well, because now internet is very much widespread. Uh, it is uh, it is unreasonable on the part of the employee who wants to resume work and who wants work, which is very rare nowadays, not to furnish internet, which is very easy now to access. Now, we should no longer anymore add burden to the employer for example, now they have a lot of losses. Those little things will be shouldered by the employee, that the internet access. Please take note that if you refuse to work because of the of no internet, and you are being required just to work at home, then that is a valid reason for the company to terminate your work and just give it to the others who have internet. And please take note that we have a lot of people who have internet access. So if you do not want employment, and if you want the company just to shoulder everything, including your internet access, then that is too much already. And they may give it to others who have internet.
Okay, okay. So,
And
eto,
please,
Doc.
I would like to add that that is a valid classification. That is a very valid classification. So do not refuse to work. The warning, if you do not have internet. Provide one for you. Anyway, you can recoup those losses once you have the employment. Very very hard now to be employed.
No, that's so true, Doc. So, going back to the work from home scheme. So, of course, a lot of companies adapted to this, and also even made interim rules as they go, especially if di sila sanay sa work from home setup. Now, during this period, for example, yung employee broke some of these company rules while working at home, can this be ground to terminate the employee?
Well, it will depend on the reason. For example, you are employed by a company based on your management capability. Well, that's a very valid reason for you to be terminated by the company. But if it has no if the reason is just superficial, and the company cannot just terminate you right away, especially if you are rank and file employee. You are protected by our labor laws. Only if you are, for example, you are under the management, you are a managerial employee, you are more vulnerable to be fired during the work from home, because there are a lot of company secrets, company policies who are entrusted to you. But the rank and file employee, it is very hard to terminate them because they may not be related to the sensitive portion of the company's rules and procedure. So yan po, ang managerial, ang delikado dyan sa work from home. They can be terminated anytime by the company because the confidence and trust has been, for example, has been breached.
All right, makes sense, makes sense. Now, we have another question here regarding hazard pay. Now, is there a law or policy that HR practitioners can refer to for employees of private companies? Like, will they provide computation,
Well,
or what's the computation?
the interim rules already stated this now, but of course it is not classified as hazard, but it is actually hazard. Uh, Here, th- there were actually issuances by the DOLE as far as hazard pay is concerned. Uh, those who are working outside the company, whose work can only be done outside, then the company is mandated to give all the necessary benefits, especially if they acquire the you can refer you can refer to the website of DOLE. No? There are many issuances there as far as the risky payments of those who are exposed to hazard. So they can just refer to there are a lot of issuances, resolutions, and regulations. Please take note that these were formulated not only by DOLE but also by DTI and in cooperation with the DOH, the Department of Health.
All right. So, for our viewers there, are there any questions? We have, yes, we have a few more minutes with Dr. Nee. Or was there any, or does anyone need clarifications with the different topics covered today?
Ito po no additional lang bago kayo pumasok sa kumpanya. Please take note yung face mask, alcohol at saka even the thermal scanner, dapat meron ng kumpanya diyan for proper screening. Kasi delikado rin yung co-employees mo, especially very dangerous those who have no symptoms. Yung wala kasi napakalakas nila, they are just carrier of the virus. So these are still included in the interim rules. Before you enter a company, and also the vehicles. Yung mga vehicles kasi nagdadala ng viruses yan. every 2 hours ang disinfection. Materials, equipments, vehicles, every 2 hours. Minimum, every 2 hours ang disinfection. At yung disinfection, hindi lang yung kukuha ka ng Clorox at saka idadilute mo, no? Ang mga disinfection substances, solutions, must be acquired sa mga chemical companies talaga.
All right, all right. Thank you so much for that, Doc. And to all our viewers, thank you so much for giving us your time. So now we all know na there's a lot of fear of going back to, of course, to the offices and so on. So, for example, if your companies are also looking into virtual recruitment or may mga questions kayo regarding how HR is going to operate during this new normal. So yes, feel free to reach out to FastJobs Philippines. And we'll also be sending over a copy of today's webinar over to your emails in the coming days. So yes, thank you guys so much. And I hope you all had a very insightful participation here sa webinar. So yes, Doc, thank you so much. And yes, uulitin.
Thank you very much po. Thank you very much for your opportunity.
Yes, thank you guys.